Hi there everybody, welcome back to my channel. Today I will be talking about blocked tear ducts and specifically blocked tear ducts in children, and I will be discussing how massage can be effectively used to try and treat this very common condition. If you want to learn more, then please stay tuned. Blocked tear ducts are very common, and the signs that a parent may see with respect to blocked tear ducts include gunky eyes, watery eyes, even swelling around the eyelids due to the fact that they constantly have moisture on them. When babies are born, a membrane within their normal anatomy has not yet opened, and due to this, commonly children can have watery eyes. The statistics say that it can be present in up to 5% of newborns. The image on screen now shows which membrane is obstructing the passage of tears through the tear drainage system. This condition itself does not threaten vision. However, you should seek the appropriate consultation with an eye care practitioner to rule out other causes of watery eyes in children, as for example, congenital glaucoma can present with watery eyes. So it's important to get the diagnosis correct before you start considering different treatment options. This diagnosis is a clinical diagnosis, meaning tests are usually not performed to try and investigate. However, a neat test that can be done in the clinic is using fluorescein dye. So this is a orangey green dye, and what happens is you pop a drop of this into each eye within the lower lid, and then after approximately 5 minutes or so, you observe to see whether this dye has passed through the tear drainage system. You do this by essentially looking up the patient's nostrils with blue light to see if there's any evidence of this dye. If there is no evidence of this dye, then usually this is a very good indication that the tear drainage system is obstructed. Once the diagnosis is made, then it's important that the area is kept as clean and as dry as possible. So clean is for obvious reasons due to the fact that there may be gunk present, and in terms of keeping it dry, that's because if there's constant moisture of tears spilling over onto the skin around the eyes, then this can cause irritation to the skin and even result in inflammation. Commonly, we tell parents to keep the area dry and clean by using simple cotton balls. The next important aspect of treating this condition is using massage, specifically the Kreidler massage technique. The purpose of performing this massage is to try and increase the pressure within the nasolacrimal system. Again, look at the picture on screen now, and what that will do is try and encourage the membrane to open and therefore allow tears to drain out. The way that one should correctly massage this area is by applying pressure here where the tear sac is present, and it's important to apply pressure on the bone itself, and then simply work your finger downwards, which is where the rest of the nasolacrimal apparatus is situated. It's important to do this on 5 occasions, like this, back to back, and this needs to be done 3 times a day. Other methods, such as massaging in this particular motion, and then not completing the massage downwards, are questionable in their effectiveness. Occasionally, if there is an infection present, then antibiotic drops may need to be used, and some pediatric ophthalmologists and some pediatricians also occasionally recommend a drop of breast milk into the eye, as this has several good properties, including properties that are antimicrobial. Most cases of nasolacrimal duct obstruction will resolve by the age of approximately 1 year. If not, then the surgical option of probing plus or minus stenting can be considered. However, again, some pediatricians and some pediatric ophthalmologists recommend waiting slightly longer, potentially up to 18 months of age, because this again may allow spontaneous resolution of the issue. It's important to note that massage can facilitate in the spontaneous resolution of the condition and therefore negating the need for surgical intervention. One thing that parents should be aware of is if their child develops a painful red lump around this area, roughly in line with the eye, then that could mean that the tear sac has become infected, and that will require oral antibiotics. So it's important to look out for this. As ever, if you're unsure, then please seek the appropriate eye care advice anyway. Thank you for watching this video about nasolacrimal duct obstruction. I hope you've learned about how common it is, how it generally tends to resolve spontaneously, how massage can be used effectively, some of the signs to look for in terms of infection, and some of the surgical options that may be considered if it is not resolving. If you've liked this video, please give it a thumbs up. Please click the like button, the subscribe button, and do comment. I'd love to hear your stories, particularly if you're a parent and you deployed some of these strategies, i.e. massage or breast milk, and I'd love to hear how effective you found them. Until next time, take care.